Hi, nice to meet you. I am Mark from VanGlow, and I'm here to present our device. So as we all know, from this competition, vancomycin has a series of issues, mainly the inter-individual variability and the time and cost that it takes. But that's why we have created this prototype, and I have to say that we're very glad that it's actually quite near completion. So there's four main parts that we want to really focus on. The first one is that it's accurate and quick. It's cheap, user-friendly, and it's reusable. And what do we mean by reusable? So one of our key points is using a TMR sensor. It's the latest sensor on the market, and it hasn't been used for biosensors before. And our ELISA-based magnetic system is actually not on the sensor, but on cling film, which means that once the sample is done, you can throw it away, but the sensor is still there. You don't have to buy a new sensor every time you want to do a test. Apart from that, another key advantage is that we're developing a magnetic washing, which is a free wash system. So it avoids like all the other necessary steps from now on. So we're going to go now to the pricing. So since we're targeting mid-sized hospitals currently, that don't have a lab equipment for testing and they have to send it far away to another lab, which costs, again, money and time, we're thinking of selling the device for, let's say, around $500 with a small margin and focus the sales on the cartridge sale, which we do have a large margin because we're selling them for $1. Here is a graph that we made. So as you can see, we're predicting that the first 2 years is going to be a bit of a rough time. But by the third year, we're aiming to sell, if we commercialize it, around 2,000 devices. And it's going to be the end break. And it's going to be a steady increase that we project from there on, hopefully. And why do we say this? Well, not only we actually have a long list of sponsors, we have a better partnership with MTD, which gave us the sensors, but also, as you can see on the screen, we have the medical auto control equipment, Mace company, interested in maybe trying to commercialize with us, as well as we have another company called NG Biotech, which we're planning on having contact with for another partnership, pursuing a patent and license design. So we're moving on to the client validation stage already. And there's already a hospital that is interested in using our device and testing it against other methods. So we can prove, apart from this competition, that our device is nearly ready for healthcare applications. But that's not all. That's only the first start. Then we're going to move on to large hospitals if we're successful. And the actual end goal is to use this as a whole-base ELISA magnetic system that would replace an ELISA base on fluorophores for any application in institutes, labs, and healthcare. I would like to thank all our sponsors, products, and consultancy, as well as Huckleberry Hooper for aiding us in this project. Any question? Yes?
Patients do you have to diagnose to get to 22 million euros in 5 years?
Ooh, that is a complicated question. And for the questions, I'm going to pass the baton on to Anwar. He's the other. So he's the other teammate. We're both in like outreach and business.
Yeah. So basically, we are targeting. We aim to sell 2,000 devices. We just made estimation like the cost of the cartridge is $1. So it's we have profits 0.9 because the cartridge is cost $0.1. So $0.9 and per test. And from our estimation, hopefully that we can reach this this target. So the question about how are we going to reach? Sorry. How many patients? How? Okay. Yeah. Okay. So yeah. Sorry for that. Yeah. So we estimate to sell 20 tests per day. So 20 multiplied by 365, and yeah, you make the for each device. So 2,000 multiplied by
What also means is that we're calculating that if it depends a lot on how many devices a hospital is actually going to buy. Obviously, if it works, we're going to get obviously more sales of the device. But we're thinking that if it's used on a bedside of a patient, let's say that there's about 5 devices per part of a mid-sized hospital level, and in this level, there's say around 40 patients. I would say, do you have a calculator? Because we have no calculator that. But I would say that to reach the 5-year goal, because the question was for the 5-year goal, no? We would need to sell it to, let's say, at least, let's say, 100 hospitals, I would say, at least, between 100 and 200. But we can do the calculations, and you can approach us later, and we can do the calculations. Does anyone have any other question? No? Okay, well, thank you very much for listening to us.